If you're an older man, maybe over 50, maybe over 60, I need to ask you something. Have you ever wondered whether masturbation is truly healthy at your age? Or maybe you've worried quietly, afraid you might be causing some kind of invisible harm. You are far from alone. This topic is surrounded by confusion, outdated myths, and a real lack of clear, reliable guidance. It's one of the most common but unspoken concerns men face as they age. Studies show that most men over 60 continue to masturbate, but many are doing it in silence, unsure how it affects their hormones, their prostate, or even sexual performance with a partner. That's why today, we're going to have an honest, science-based conversation. I'm Dr. Jocelyn Carter, a urologist with 5 years of experience in men's health. Today, I'm going to walk you through 10 surprising benefits of masturbation in mature men, 10 potential risks, and how to practice it in a healthy, safe, and conscious way. By the end of this video, you'll know not only why masturbation can be beneficial, but also how to avoid the pitfalls that many men don't even realize exist. Oh, and before we get started, I'd love to know, where are you watching from? Drop it in the comments, hit like, and don't forget to subscribe for more practical, science-backed advice on men's health. First, let's bust a big myth. Masturbation after 50 isn't inherently harmful. In fact, when done mindfully, it can be a powerful tool for your physical and mental well-being. But, and this is crucial, it's all about how you do it. Mindless or overly aggressive practice can create problems, just as mindful, moderate practice can provide surprising benefits. In my 5 years treating older men, I've seen firsthand how masturbation, when practiced consciously, can support penile health and elasticity, promote prostate function, reduce stress and improve sleep, maintain sexual desire and neural responsiveness. These aren't opinions. They're backed by peer-reviewed research, clinical experience, and real-life outcomes. 10 surprising benefits of masturbation for mature men. 1. Maintains penile health. Achieving an erection increases blood flow to the corpora cavernosa, the spongy tissues responsible for firmness. Think of it as physical therapy for your penis. Regular exercise helps maintain tissue elasticity, which is critical for achieving and sustaining erections as you age. 2. Promotes prostate health. This is huge. Harvard studies show men who ejaculate frequently have a significantly lower risk of prostate cancer. Regular ejaculation helps flush out harmful substances and secretions that can accumulate in the prostate ducts over time. 3. Strengthens the pelvic floor. Orgasm engages key pelvic muscles like the pubococcygeus. A strong pelvic floor improves erectile function, ejaculatory control, and helps prevent urinary incontinence, an issue many men face after 50. 4. Reduces cortisol and stress. Orgasm leads to a drop in cortisol, the stress hormone, which helps regulate blood pressure, lower anxiety, and protect cardiovascular health. It's a natural stress relief mechanism built right into your body. 5. Releases feel-good neurochemicals. Orgasm floods the brain with dopamine, pleasure, and oxytocin, bonding, creating a natural mood boost. You feel more connected, more satisfied, and mentally sharper. 6. Encourages self-detection of physical issues. Regular self-pleasure makes you familiar with your own anatomy. This helps detect early signs of testicular lumps, penile fibrosis, or other anomalies, sometimes before they're clinically noticeable. 7. Improves sleep quality. After orgasm, oxytocin and prolactin rise while cortisol drops, producing a sedative effect that promotes deep, restorative sleep. Sleep often becomes more challenging with age, so this is a simple, natural way to improve it. 8. Enhances pelvic circulation. Beyond the penis, masturbation improves blood flow throughout the pelvic region, which benefits the prostate, bladder, and surrounding musculature, reducing stagnation and inflammation. 9. Trains ejaculatory control. For men who struggle with premature ejaculation, masturbation provides a private space to practice techniques like the stop-start method, helping translate control into partnered sex. 10. Keeps sexual desire and neural pathways active. Your brain is your largest sex organ. Regular stimulation keeps neural circuits firing, maintaining libido and sexual responsiveness, even if you don't have a regular partner. So, masturbation has many benefits. But let's be clear, it's not risk-free. How you practice it matters. Let's now look at 10 potential pitfalls and what you can do to avoid them. 1. Social isolation. If masturbation replaces real-life intimacy, it can lead to loneliness. Solution: ensure it complements your social life and relationships. 2. Skin microlesions. Aggressive technique or lack of lubrication can cause tiny tears and irritation. Solution: be gentle and use water-based lube when needed. 3. Desensitization. Stimulating in the same way every time may make arousal with a partner difficult. Solution: vary pressure, rhythm, and technique. 4. Masking erectile dysfunction. If you only get erections during masturbation, underlying conditions like heart disease, diabetes, or hormone imbalances may go unnoticed. Solution: track patterns and see a doctor if needed. 5. Nerve compression from poor posture. Hunched or hard chair positions can compress pelvic nerves, causing numbness or pain. Solution: practice in comfortable positions. Lying down is ideal. 6. Emotional escape mechanism. Relying solely on masturbation to cope with stress can create dependency. Solution: have a diverse emotional toolkit. Exercise, meditation, and social interaction. 7. Guilt and shame. Cultural or religious taboos can create distress. Solution: consider speaking with a sex-positive therapist to reframe masturbation as a healthy act. 8. Pelvic congestion. Excessive frequency can lead to heaviness or discomfort in the testicles and pelvic region. Solution: moderation, listen to your body. 9. Semen. Quality. Frequent ejaculation may temporarily reduce sperm concentration. Solution: allow 2 to 5 days of abstinence if fertility is a concern. 10. Disconnection from reality. Heavy reliance on extreme pornography can skew expectations. Solution: balance visual aids with imagination and real-life experiences. Here's the bottom line: masturbation after 50 isn't good or bad. It's a tool, and how you use it determines its impact. Practice with awareness and moderation. Prioritize comfort and posture. Use lubrication when needed. Balance masturbation with real-life intimacy and emotional connection. Listen to your body signals. When done consciously, it becomes a powerful ally for sexual health, prostate protection, mood, and sleep. I know talking about this can feel awkward, but your sexual health is a normal, vital part of overall wellness. Small, mindful adjustments can restore confidence, comfort, and vitality, even in your 60s and beyond. I'd love to know, what surprised you most about today's discussion? Comment below. Let's continue this important conversation together. If this video helped you, like, subscribe, and ring the bell so you don't miss our next discussion on mature men's health. Remember, age is not the end of vitality. With awareness, moderation, and respect for your body, you can maintain comfort, confidence, and sexual freedom for years to come. Stay healthy, stay curious, and I'll see you in the next video.